Hi, folks. This is John Adamson, the Rehab and Documentation Guru. And right now I'm going to talk about a question I got a while back and I just didn't get to answer it. So I apologize, Charles. So this goes out to you. And so Charles has an in-home Part B practice. And by the way, I'm looking to interview him at some point. And he had this question about maintenance therapy. Basically, once he established that a patient was um, plateauing, which is generally a word I teach to avoid on documentation, but they are plateauing. They're not improving anymore. They're not rehabilitating, and it's determined that they need maintenance therapy to keep where they're at. Is it okay from a billing perspective to maybe reduce them to one time per month and then see them, let's say, for a few months and establish that these once a month intervals are demonstrating a maintenance of the patient, which is their right? Is it appropriate to maybe do this for about 3 months and then reduce frequency even further and maybe see them for every 6 to 12 months for a visit just to see that they're maintaining? Well, I think there's a lot of gray area with that, to tell you honestly, Charles, and I think it's going to depend on your patient. I have heard that there have been denials of patients that go much below one time a week for maintenance therapy. And so this would definitely be applicable to you, where you're seeing them just once a month. I would assume, and maybe this is incorrect, and again, I think this kind of gray, that if I get to the first 1 month follow up and they were still fine and they're doing their home program fine, it's probably safe to just discharge them at that point. And that would be me looking at it as a reviewer. If you get to the point where the patient and caregiver can safely and effectively carry out the home program, and you've established that they're maintaining okay with a good standardized test, so let's say you use a good test with good psychometric parameters on it, and they test virtually the same from 1 month ago to today's visit, where I'm just reassessing that are they truly maintaining. If they're virtually the same, and I've got I'm the one that's doing the assessment, and I did the previous one, so I know intra-rater reliability is not an issue, I'm probably going to discharge them, because I don't know that we could really justify the once a month visits. And I think it's just more of a matter of practicality. It's not regulatory. I'm not seeing anything about frequency and duration on maintenance patients at all. In fact, two things I would just point out. One is that, as I usually tell people, to reduce their frequency to the point where the patient starts to decline a little bit, and then you know what you've got to maintain for the frequency to keep them where they're at. So, for example, if you're seeing them twice a week and they're maintaining, and you drop them once a week and they start to decline, well, then you know that twice a week is absolutely necessary. So that's one principle. There's another principle, though, and this is evidenced in a little case scenario that I go back to once in a while, and I think how ahead of her time she was. But back in the early 90s, the APTA president was Marilyn Moffitt. And I will never forget, but there was an article about her. She was doing home health. In addition to being president of the APTA, she was doing home health, and she was seeing a patient in a home setting every other week. And it was clear that she was, going in, reassessing them, adjusting their home program. And that was truly a skilled approach. So once every other week. So even then, we saw people that were very knowledgeable in the area of therapy service provision, like Marilyn Moffitt, utilizing this not very high frequency approach to care. And so I guess I would say to Charles and anybody that's doing something like what he's doing is that I think it's gray. There's no regulatory stuff. If you can prove that you going in once a month is absolutely necessary, and you going in once a month looks different from your previous month, meaning you had to do some kind of adjustment to make sure they maintain, that's perfectly fine. But if you get in at these once a month intervals and your approach looks the same each time, then those subsequent visits aren't necessary. So anyway, I hope that helps. Charles, I think there's a lot of opportunity for interpretation. It's going to boil down to the individual patient and, of course, the solid documentation that you're providing. Anyway, take care, God bless, and have a great day.